Good morning. This is the OHSU Effect, Inside Health and Science at OHSU. Thanks for being with us. I'm Lacey Evans. On today's show, we're going to talk to a pediatric endocrinologist about obesity in children. We're also going to discuss how childhood obesity could be related to what mom eats during pregnancy. Fascinating research going on up at OHSU. But first, we have to talk about breast cancer. It's on everyone's minds as tomorrow is the Komen Race for the Cure. Thousands of people participate in this fundraiser on the waterfront. Of course, it's for cancer research, everyone in their pink shirts. Dr. Carol Marquez is one of many doctors who see breast cancer patients at the OHSU Knight Cancer Institute. And by working with doctors from several disciplines, she has insights into the latest treatment trends and research, and we are very lucky to have her on with us now. Good morning.
Good morning.
So this year marks the 20th anniversary for the Race for the Cure in Portland. How far have we come in that past 20 years in treatment?
Dramatically. We've come a long way in both surgery, in radiation, and in chemotherapy. All of these areas have shown dramatic improvements over the last 20 years.
What options are available today that maybe weren't available 20 years ago?
Well, in surgery, we've had breast preservation therapy for the last 20 years, but within breast preservation therapy, the standard had always been to treat the whole breast, and now there's the option of partial breast irradiation where the treatment can be given in a week or sometimes in a single dose. There's also many improvements in plastic surgery in terms of what reconstruction options there are for a woman. And then in medical oncology, the chemotherapy has dramatically improved as we've just gotten better agents. We're better at taking care of the patients while they're getting their chemotherapy so they have fewer side effects. And then the radiation has improved also just in the way that we can give it and in trying to reduce the side effects that we see from it.
Is it safe for me to assume that that means higher survival rates?
Yeah, we are starting to see higher survival rates. It's not as dramatic as you might like, but as we all might like, but it is better, especially with some of the newer chemotherapy agents.
Tell us about the IntraBeam. I know that's a new technology that was introduced just about a year ago, right?
Yeah, a year ago, January. It's a device where we give a single dose of radiation in the operating room to very select patients, and that's their complete radiation treatment. They don't need any additional radiation after that. It is for very, very select patients. We have very specific criteria. If patients don't meet that criteria, we recommend they get the standard treatment, which is whole breast irradiation.
So you get one shot of radiation and then you're done?
Yes, but
Wow.
It's, again,
right.
For very specific patients.
Well, that's kind of what you guys are studying up there, just a very personalized medicine, targeted therapies. Can you kind of explain what that means and how these therapies are different than traditional therapy programs?
The goal of the targeted therapy or personalized medicine is to really look at each patient and their tumor and try and find a treatment that better suits them. And the hope is that by more genetic analysis of tumors that we'll be able to come up with more specific therapies for a specific tumor. And it's not just in breast cancer. We're looking at it in all types of tumors.
Are there genetic tests that women should be getting from their doctors to determine the best course of treatment after diagnosis?
Yeah, for a long time we've had a genetic test looking at the gene that's related to the development of breast cancer, the BRCA gene. And for certain patients, we do recommend that this test be done so that it can help in both in the surgical management and other long-term planning for that patient. Since if she's positive, she's going to be at higher risk for the development of another breast cancer. In addition, there's a test that can be done on a patient's tumor that can help us determine how much benefit a patient's going to get from chemotherapy. This test is called Oncotype DX. It's widely available, but we use it extensively in those patients that are also eligible for that.
Let's talk a little bit more about genetics and how it plays a role in breast cancer versus, our environment and lifestyle. Talk about that.
Well, genetics is hard to overcome. So you get what you get. And really the biggest risk factors for getting breast cancer are being a woman and being older. So again, those are two things you can't get rid of. But there are some what we call modifiable risk factors, things that you can do to change your risk of developing breast cancer. Those include the things that you've always heard of, not gaining too much weight, exercising. We don't know as much about specific dietary recommendations like we do for colon cancer, but not gaining too much weight is probably the most important part. And then the other one that has been implicated in breast cancer is not drinking too much alcohol. And by that, we mean not to average more than a drink a day. So, some people wonder, can they do all their drinks on Saturday? We don't really know, but we say don't average more than a drink a day.
So if you are predisposed, maybe you have that gene that you're talking about, can we make these lifestyle choices? Will that offset that at all?
We don't really know, but probably not. That if you have that gene, that's probably going to overshadow these other modifiable risk factors. So you have to plan things according to having that gene.
So let's talk about now breast cancer screening, mammograms. What age should we start getting them?
This has been very controversial. It's been in the press a lot. I think my current recommendation for my patients is to get screening at 40 and continue that. The other thing we haven't done a lot of research on is what's the upper age limit. Patients should stop screening if there is an upper age limit, and we haven't asked this question before. Now that we have a lot of older people, I don't know if it's going to be a research question, but for now we say 40, annual mammograms at 40. And up until at least 70, if not older.
And what about that genetic test? What kind of signs in our family should women be looking for if they need to get that genetic test?
If you have multiple first-degree family members with a history of breast cancer, and especially if you have family members who have premenopausal breast cancer, those people should definitely be consider getting a genetic test for the development of breast cancer.
What about MRIs? Do you guys use that?
Yeah, we do use MRIs. We use MRIs extensively in the evaluation of newly diagnosed patients. So patients who know they have breast cancer, there are some of those patients where we need to get an MRI because their mammogram is difficult to evaluate. And then there are some patients we use MRI for screening, but mammogram is still the primary tool used for screening.
What do you see on the horizon for breast cancer research and treatment?
I think we're just going to continue to get better, especially along these lines of tailored therapy. For example, at OHSU, we're doing this trial right now called the I-SPY trial, where people with advanced more advanced breast cancer, palpable tumors, things that we can see on MRI, are considered eligible for this trial, and they get chemotherapy before they get surgery, and we evaluate how the tumor responds to that chemotherapy. And if it doesn't respond to that agent, we switch agents. So we look to see actively as the woman still has the tumor in place to see if her tumor is responding. I think those kind of very tailored, targeted therapies are more in the future. And I think it's going to build on the success of Herceptin, which is one of the newer drugs we've had in the last 20 years that's specific for women that are HER2 overexpressing. And that has shown a dramatic improvement in survival for women that receive that drug. It's those kinds of improvements that are very specific, very tailored, that I think we're going to get better at. I think the surgeries continue to get better. The plastic surgery options that we have now are so much better than we had before. The options for reconstruction, for nipple preservation, these kinds of things are just make a huge difference in the quality of life of the patients we care for, and really allow them to have more choices and better choices.
Yeah, it sounds like it's not cookie cutter anymore. It's like you really look at the patient and see what's best for them. It might not be surgery. It might not be radiation. It could be anything.
Well, yeah, surgery and radiation are still often part of a lot of people's treatment. That's why we still have these multidisciplinary teams, which includes all of these people. So we can each have our input up front and try and give the patient their options. I have to admit it gets confusing for patients because they have more options, and sometimes people are just like overwhelmed. But with, sufficient information and sufficient time, they usually can make a good decision. Unfortunately, there is a lot of information out there.
And are you going to be in the race for the cure tomorrow?
Yeah, I will be there.
Good. Well, how can people contact you if they're more curious about, this research or maybe getting an appointment up there?
Well, you can call our office, and I'm sure you can go through the website and find it. I don't know. People manage to find me pretty easily.
Well, that's good. Well, Dr. Carol Marquez, thank you so much for joining us.
Thanks.
That's Dr. Carol Marquez, one of the doctors up at the OHSU Knight Cancer Institute working on breast cancer research. And coming up next on the OHSU Effect, what happens in the first 1,000 days of a child's life will impact them forever. We'll talk about that in 5 minutes. And of course, don't forget to check up on our webpage for podcasts or any other interviews that you missed. That's ohsueffect.org. Of course, you can also go to KXL.com and click through to the OHSU Effect page. This is FM News 101 KXL. We'll be right back.